autoridades y panelistas.
Dear Honorable Justices, panelists, participants, I would like to thank you for participating in this Environmental Justice Forum and to congratulate the second environmental court in this area, considering environmental sustainability from different areas. Our environmental organization was affected by the different situation, and Chile is a pioneer in the development of a specialized publication in this area. And I would like to highlight the important role of the environmental courts in Chile, that it has been acting in the resolution of these situations in Chile, having better protection of the environment. The work of our courts and the ruling have all become an important guideline in designing the public policy strategies and all of our administrative actions. The control exerted by this is enforcing the highest standards in our activities, and this includes important environmental activity, but I would like to express one, which is climate change. Climate change undoubtedly is one of the main threats that humankind is confronting. To struggle against this is an ethical imperative, and it has been the approach of our government. Right in the middle of the pandemic last year, in the middle of the year, there was a presentation of an international acknowledgement in the increase of the climate activities added to the new NDCs in the year 2020. We presented the carbon neutrality for 2050, and it was approved by the Senate in August last year. The law for climate change will have Chile having a constitutional framework for the long term that will overcome the different governments or surpass the different governments by leaving a clear road of our country to be able to reach an important activity for 2050. Considering the challenge that we have, the environmental justice will be very relevant, and our courts will be the participants in these activities in Chile. Much needs to be done, but we are moving forward with clear goals based on science, with a long-term view, as well as with sustainable development as the basis of our economic growth, social development, and the protection of our environment. Thank you very much.
Agradecemos así la disposición de
We want to thank the Minister of the Environment to participate in this opening ceremony. Through these three different activities of this forum, it became consolidated in Chile as one of the main ones in the region, having different honorable justices in the different areas at constitutional level as well as in environmental justice, linked to the different expressions of environmental law as well as national and international level. In this fourth version, the second environmental court focused in considering the most important activities that are in the international and national activities. To open this fourth international forum on environmental justice, we would like to leave the floor to the Chief Justice of the Second Environmental Court in Santiago, Chile, Mr. Cristián Delpiano.
Buenos días a todas.
Good morning. I would first like to thank each of the presenters from different countries that have kindly accepted our invitation to participate here today and to share knowledge in this fourth International Forum for Environmental Justice and organized by the Second Environmental Court. I would like to thank each of the ones that have decided to provide their time to participate in this activity and participating from the distance. And as well, I would like to thank each of the workers in this court that, given the different challenges that we're going through this time frame, they have made a tremendous effort to consider an event that has become an institutional tradition. This is also connected to the main essence of this activity. The choice of the word forum considers meetings that has to be adapted throughout the world in this past year, given the sanitary emergency related to COVID-19. Given this challenge, in our first panel, we will be talking about the relationship or link between health and environment, especially looking for the choices or lessons that we can obtain from COVID-19 and which are the changes that we can view for the following years. The sanitary emergency cannot mean that we will leave out other structural organizations that has meant the activities of these past years, such as environmental activity. The litigation activities of the environmental issues in Chile and the rulings are many of the thoughts that means that there is still much idea harming our country. This is why our second panel will be fully dedicated to these activities. The idea of a forum is considering the existence of a discussion. Discussion means the concept that we'll be considering the future of our country in the future years. Now, considering a constitutional activity that we have not seen before. As a matter of fact, the parity in gender issues, as well as in this forum, and the reserved seats for indigenous people and the recently approved Constitutional Assembly is considering that this is a historic activity. The special protection of indigenous people coming from human rights is the important aspect of the third panel, as well as the incorporation of their view of the world within the legal activities in the world and what is going to be considered in a fundamental activity. The role of the environment in this activity and the institutional scheme that will be resulting is not only part of the environmental courts, but it should be considered by all of the Chilean people. And this is why the fourth panel we will be talking about constitution and environment in this area. And there is no discussion without exchanging ideas. And as considering the previous panels fifth and sixth in this forum, we will be talking about the environmental principles as well as to share the judicial experiences. The relevances of the environmental principles is considered in the law 19,300. In its history, it was expressed that this becomes a reference point to consider new environmental standards, but they can be used by the administrative authorities as well as the courts in interpreting the standards or laws in specific cases, especially when they are not clear enough or they leave area for discretionality. Now, considering that there will be different activities in the decision-making process. In each of the activities that will be presented in this forum mean that there are challenging subjects, such as the environmental courts in Chile. This is why it becomes very important to learn from the compared experiences, such as Honorable Justice Rafael Fernandez and Mary Kay Lynch are here in this panel. And they will be sharing their activities in their countries. So the contingency as well as the structural conditions are combined, establishing the invitation that we have for today and tomorrow. And it cannot be any different as this considers the relationship that exists between the contingency and the structural activities. We can just even consider climate change, but we're using it in daily conversations during the pandemic. And in climate change, as well as the pandemic, we have issues such as the economic environment. In the case of the pandemic, we can see how the world has made tremendous efforts to share the economic and sanitary aspects to be able to live with the virus and not stop the economy in full. But in these three different areas, mitigation, adaptation, and compatibility, sometimes it gives us the feeling that the world is putting tremendous efforts in sanitation, but climate change does not seem to be in the first line of the agenda. So maybe climate change should also be considered a pandemic. This is going to be left to thought. And finally, I would like to invite all of the participants to really be active in these exchanges through questions that undoubtedly will be making richer all of the activities that we have prepared for you. And I would like to mention that the participation that we have here today means that these instances, it doesn't matter how tragic the times, we'll find ways to overcome this and to maintain their own activities, such as establishing communities, to be able to exchange knowledge and to create discussions around ideas. I would like to end these words by opening the ceremony, by opening the Fourth International Forum on Environmental Justice. Thank you very much.
We thank Minister Delpiano for his remarks. The period of 2018 and 2000 of this forum have brought together a number of individuals from a variety of areas and different latitudes, as well as an audience of over 200 professionals and other individuals, people associated with environmental justice in our countries. This year, we are grappling with a pandemic that unfortunately has not enabled us to hold this event as we would have liked to. However, the court has been able to bring it to fruition virtually. COVID-19 is the topic that will kick off this fourth forum. Therefore, let me give the floor to our keynote speaker to address the topic of justice in the context of COVID-19. Let me give the floor to Marcelo Korc of PAHO, the Pan American Health Organization. He is the head of the Climate Change and Environmental Determinants of Health at the Pan American Health Organization. Thank you. Thank you all for this opportunity to address you here today to present a vision of from the prism of environmental health is a response to the COVID-19 crisis. I believe that the justice and two justices who have spoken before me have already referred to the importance of environmental health in this context of the pandemic and how we can also approach this in terms of the impact on climate change as well as in other areas, as the Minister of Justice has just noted. I'm very pleased to be here at this Fourth International Forum on Justice, and it is important to note the concept of environmental justice as well as what we call in healthcare the equity or equality, and striking this balance between environmental justice and equity or equality in access to healthcare. Today, I would like to update you a little bit about the current status of the pandemic, although I would assume that all of you over the course of the last year have been glued to your TV screens, to social media, and that you are cognizant of this. And I guess I'm adding a bit of few twigs to the fire, as we say back in my home country of Uruguay. But nonetheless, because I represent the Pan American Health Organization, it's also important to look at what the official figures are with regard to this pandemic. But what I'd really like to focus on is this morning is what is the potential impact that this crisis can have in the Americas. I'm not going to refer specifically to the case of Chile. I will leave that up to the country experts to address what the context is domestically within Chile. But I do want to talk about what we are doing at PAHO in response to the pandemic. And the most important part of this presentation, I guess, is what both justices have mentioned, which are the lessons learned, the thoughts that we can bring out of this process of the pandemic, that we've been able to, conclusions we've been able to draw as a result of this last year and a half of this pandemic. Now, from the epidemiological perspective, we have to be precise. We have to say that 3 p.m. on Wednesday, the 12th of January 2021, I know that sounds a little nitpicking, but that is the way to present these official reports. PAHO's report, therefore, for that date indicated that there were approximately 90 million cases worldwide. And we had officially detected 90 million cases worldwide, and in the Americas, it was almost half. That is to say, 40 million cases of those cases officially registered or recorded happened in the Americas. Also, in terms of death, of the 1.95 million deaths that have occurred as a result of the pandemic, some 930,000 of those took place in the region of the Americas. Now, what does this mean for different countries across the region in terms of what has happened in the last 24 hours? That is to say, through January 12th, we have the statistics that have seen over 1,000 new cases in the last 24 hours through 3 p.m. on the 12th, and we're talking again just about the Americas. That is to say, this is not worldwide, but just within our region, the Americas, north to south. And this includes a number of countries in terms of the number of cases, as well as the number of deaths. The number of cases is over 1,000. The number of deaths in the last 24 hours is over 100 deaths. Again, that is through the period of the 11th to the 12th of January. We also see the accumulated cases through January 12th, both the accumulated incidence per 100,000 inhabitants with, and we can see this in different colors, that are going from 100,000 and different individuals through through the pandemic, through December of 2019, through January of 2021. And what you can see on the smaller areas are all of the number of cases that we have seen in general terms. In the Americas, we can see the certain variation there that is we have better interventions in public health, as well as in cases that are a result of poor surveillance or the inability to identify the different cases or the ability to perform effectively. So that is what we officially know, but I would not say that it is necessarily an exact, precise map of the situation of the pandemic, but it is what we can do to the best conditions possible with the data that we have available. We have done and seen what the pandemic is within the impact on the environment, to begin to understand again what this impact is on the environment and see what we can do immediately, and as well as in the short and the mid-term, locally, regionally, and at the global level. What we are seeing immediately in terms of what we saw when the pandemic started approximately a year ago is that there was a restriction in the monitoring. There were changes in these resources where the approach has been one of monitoring the environment, bringing together resources in a number of different categories, and we can there and see the environmental situation based on the first few months of the pandemic. And there's some countries, again, where we have had different waves of the pandemic, the first wave, second wave, and in some cases, even a third wave. That is the global level in terms of how we are monitoring the environment. And what we've seen immediately is that there's been an improvement, particularly the question of air pollution that has dropped as a reduction in traffic. I would imagine that in Chile, you've seen this as well. Of course, you have several cities that are very much affected by air pollution. I would imagine that in Santiago, you were able to perceive at the beginning of the pandemic a sharp decrease in air pollution because everyone was in full lockdown and there was less air pollution during the winter time in Santiago. I think that is the same, but nonetheless, we are beginning to see issues with our water basins and pollution there, which is a result of discarded medical equipment, particularly masks and so forth. And this is also affecting our water quality. As a result, also, for example, of large numbers of disinfectants, overly excess use in some cases, especially in runoff, because people were not sure how to clean environments effectively without polluting the environment. We can also see this, therefore, both in the short and the long term. We expect that this will be a primary benefit for the environment because, as Justice Delpiano mentioned, there is greater awareness of the environmental situation, both in the context of environmental policies that we can see in the pandemic, as well as in Chile, the framework law on climate change can also take lessons learned and engage in environmental epidemiological research, as we've seen in the launch, for example, of the Lancet of Environmental Health and the Environment at the University of Chile. We've been able, therefore, to see the opportunities that exist for this type of research in countries such as Chile. Also, in terms of the environment, if we are more sensitive to these changes in policy, in the long term, we would expect to see changes in the environment itself that would be beneficial with reduced impact, that would improve the environment for all. We can see locally and regionally at the long term, however, there will be a short and mid-term reduction in the quality of particulate air in urban areas as individuals and institutions, once they return to their regular activities of the economic activity rather, and development, we will in all likelihood see, and we are probably already seeing in several cities, an increase in air pollution again, and we need to pay close attention to that quickly so that we can take appropriate measures, preventive measures that will ensure that this does not lead to untenable levels that will harm the health of individuals and do so to a severe extent. Now, what is the cooperation, therefore, that we as an international organization can provide in response to the pandemic? It includes lines of priority action and follow-on planning for each country, communication and participation of the community in identifying risks, Surveillance, as you've seen, including rapid response teams to investigate certain cases. We're seeing this at points of entry, at ports, seaports, airports, and other points of areas such as bridges, dry ports as they're known, within the context of the international health regulations. Improvements to domestic laboratories, prevention and control of infections, case management, and in general providing operational logistical support and maintaining essential healthcare services during the pandemic per se. In response, and for those of you who speak only Spanish, I apologize that the slide is in English. I picked this up from something that was published just yesterday, but you can see the response from the organization within the Americas in terms of the technical guidelines, the millions of COVID PCR tests that have been made available, as well as making available to 34 countries gloves and other PPE to protect individuals, including masks, gowns, goggles, and so forth. And also we can see how countries have prepared regionally with different plans, again, with the tests to identify this virus and this disease, again, depending on the methodology that is used and the capabilities that exist in the different institutions in terms of surveillance. Public environmental health in response to the pandemic has primarily focused on the topic of the transmission of the virus and its persistence in the environment, both in the air and in the soil and on different surfaces, to ascertain how it is being transmitted through the air and or whether surfaces are also capable of transmitting the virus. Also, secure management of water reserves, residual waters, as well as chemical waste products are also areas that we are looking at carefully, as well as systems of ventilation in closed environments. These are the 3 or 4 primary areas that we have been focusing on.
This is how we have established different recommendations for the countries that go from water, sanitation, and hygiene, and three different areas. In those areas that are related to water activities, sanitation, and health areas, and the communities. For these 3 areas, we have different technical brochures that consider the different solutions for disinfection, how to handle the cleaning with the cleaning staff in health areas, as we're focused in all of the areas related to the clinical and medical activities. But likewise, it is important to be focusing in everything related to the staff, including the cleaning staff, as they even become more important, as it means that they have to know how the cleaning has to be done, their personal hygiene. And we have seen in the past months, this becomes a key issue as well in how to discard the hospital issues, as well as the housing activities. And vaccination, we have seen by hearing the different areas from Honorable Judge Fernandez that we're waiting for the vaccine, but this vaccine will mean tremendous products that will be discarded. And most of our countries in the region do not handle properly all of these elements, and it could cause health issues, especially problems on how to prevent accidents or to prevent incidents. Such as maybe sticking a needle that could generate diseases for those people and communities that live not only in different areas. And this is where we will be focusing in managing these products in the following months by publishing these brochures and training for the different countries, so that for these people that would like to be participating and obtaining more information, especially in the technical brochures, any warnings, alerts, and combination material, I would like to invite you to go to the website of our organization, where everything related to COVID-19 will be found in this area, where we have every information included, everything I mentioned as well. Likewise, you can see the different videos that we have for the community hand washing. I don't know if it has been the case in Chile, but one of the most important aspects that we have seen in different countries is the community considering very good activities in terms of their uh, of their issues, where different people have tried to consider non-ethical measures or not recommended measures at international national level, such as the use of the disinfection tunnels we have heard of, or chlorine dioxide that has meant black market, if you wish, in where improper information is provided to the people, and people obviously in the different communities, as long as they can consider that something can be done to improve their health conditions, and sometimes in a very sensitive situation, or maybe in a mental status that is not as good as it should be, they believe in these solutions, and they believe in non-realistic solutions, such as in some countries to establish incentives for the use of chlorine dioxide as a curing mechanism for COVID-19. I cannot talk about Chile because I've not heard any cases in this area, but for other countries, you can see it in the press. And this has meant that we will have to consider as sensitive issues. And I can imagine that the different courts in general and the environmental courts will have to consider how we can consider this within the different frameworks at ethical and legal level. And also where we have people that have been um, providing different situations to different countries. We unfortunately have had deaths of people that we all know. What are we learning then? What was just mentioned, this is one of the important lessons learned. First, and before showing the points that we have here, it is everything related to communication, but more than anything, it is the perception, communication. If it is not a two-way communication, then it does not work. We have seen how the community perceives the problems, how different communities with access to information, it means that access is not only through official means. We have seen that people in the past times are accessing information through different mechanisms, through social media, and we have to be very careful. We have to be uh, always very vigilant and to be perceptive to see how the communities, different people in their different contexts perceive the type of information that is provided to them. Environmental public health is a fundamental element for the protection of health, but unfortunately, it is lightly linked to the activities of the health sector. One of the most important problems that we have had in the past 20 years is that even though we have been able to strengthen the area of environmental protection, it has meant a weakening of the leadership of the health sector in the framework of environmental public health. And it is okay to have environmental activities being led by the environmental sector, by environmental protection, to have environmental courts, to have agencies for environmental protection. But what we really have to understand is that considering the environment from the health perspective is completely different to the view of the environment from the perspective of environmental protection. From one side, we see it from the public health perspective and always placing the person in the middle. But the environment always considers the environment in the center of their activity, and the person or health, it is just a co-benefit to environmental protection. These are completely different situations, and they have to be seen in a more integrated fashion, in a more general view, where the sector considers a leadership and the coordination of environmental public health and works together jointly with the environmental protection sector. As previously mentioned, personal hygiene has limited presence of in cultural standards of societies. Prevention and infection control, especially in health centers, has very limited resources, and how to manage hospital residue is very limited, and it is just starting depending on the country and within the countries depending on the region. I can imagine that this occurs also in Chile, in an urban area such as Santiago. Maybe is very different to what can happen in the south or north of Chile, where the economic, social, and cultural situations are completely different, and where we are also learning about the knowledge of the community in safe management of chemical products is not proper, as mentioned earlier. And something important also is that ventilation, we see that is quite limited, and it is very poorly maintained, especially in closed buildings and offices. And in the case where the energy cost is cheaper, there is no proper maintenance of the ventilation activities in the filtration gear that they should have in buildings. Also, there's very little experience in the use of early warnings for environmental epidemiology. Chile is an example at a research activities and basic research on how to manage, for example, residual waters as a early warning system. From University of Chile, we're working jointly with them, and as well as in Brazil, on how to create an early surveillance system to be able to use residual waters, municipal waters, where we see the COVID-19 virus in excretions and before it is detected in the communities. This provides us some area of 3 to 5 days to be able to detect a possible early outbreak of the disease. Same thing should be done for future outbreaks in the area of antimicrobial in general. And finally, I have general thoughts. And please, I'm sorry if I went over the time allotted, but I hope I did not bore you with COVID and the environmental management. But these final thoughts is we have to promote integration of public health within the health sector to strengthen the activities of the environmental public health entities have in terms of leadership and coordination of environmental protection, to provide the proper infrastructure of environmental services together with the health centers, and to participate in other sectors such as transportation, for example, or the industry through in health impact assessments, as well as it is being done at environmental impact level, to understand which is the environmental impact, and that the law should have an assessment of the impact in health when policies are created, so that proactively we can see which would be the impact in health that a project would have, and also to ensure the availability of the information on the indicators of public health, and that they should be fully integrated to the surveillance in health and environmental surveillance. And finally, As you can see on the slide, and as His Honorable Justice expressed, as well as the Environment Minister expressed, that there is a relationship and the lessons learned that this provide us. Climate change is no other thing than a pandemic that will last from 10 to 20 years, and we would have to see it like this. This is what's bad about it, but what is good is that it will not be as intense. But if we do not consider it in the same way, with as seriously as we're considering it right now at world level, we will be in a situation of 5, 10, 20 years where we will be thinking and saying, what did we learn from this? Where will we be in this situation? And this is where we want to be. But rather, this is the time for learning. This is the time for thinking, and this is the time to take action so that from here to 10 years, when the Agenda 2030 for Sustainable Development is over, we can say we really were able to fulfill the Paris Agreement. We fulfilled the commitment with the communities, and we are on our way to go to a carbon neutral society, to improve climate change and to reduce the impacts related to climate. Thank you very much for this opportunity, and I am open for any questions or thoughts that you might have. Thank you very much. We want to thank Dr. Korc for his interesting presentation.
And we would like to thank our judges for Germany, Australia, Colombia, and Spain, and the United States, Norway, and others, and particularly Chile, as well as representatives of international organizations for being with us. The key topics, of course, focused on the environment as healthcare, the indigenous peoples, Constitution, and the environment are topics that we have heard about and will be hearing about over the next couple of days. You can participate through the chat that has been opened for your questions for each of the panelists. These will be channeled through the moderator and posed throughout the remarks. Let me now introduce our first panel on health and environment that will be led by Marcelo Korc, the Unit Chief of Climate Change and Environmental Determinants of Health at the Pan American Health Organization, along with Soledad and García, Special Rapporteur on Economic, Social, Cultural, and Environmental Rights of the Inter-American Commission on Human Rights of the OAS, Professor Gerd Winter, Professor at the University of Bremen School of Law, and Angela Maya Arias. Our moderator will be Alejandro Ruiz, who is an attorney with the second tribunal at this court, who will be again moderating our session. Thank you very much. Welcome to this first panel on this fourth forum, International Forum on Environmental Justice. We wanted to, of course, address a topic that is of the utmost importance today, and that is the relationship between health and the environment. Whenever there is a natural disaster, the question always emerges as to what is the impact of human activity on this and the relationships and how human beings interact with that and what our responsibility may be. For this purpose, we have sought to introduce and bring international experts to bear on this topic to share their vision. As we have heard, of course, we will have an opportunity for Q&A through the panelists, through the chat on our tribunalconstitucional.cl website for this forum, and we will be posing these questions at the end. Let me remind the panelists that they have 20 minutes each for their presentations. You will be advised when you have 5 minutes remaining.
Andrea?
Andrea? Andrea, are you ready to go? Very well, then. Yes, of course. Very well, happy to do so. Justice, good morning. Let me just introduce you, Andrea, to follow protocol. Andrea Lucas holds a Ph.D. in law and social sciences and from Argentina at the University of Córdoba. She has a master's from Heidelberg University as well as the University of Chile in international law. Thank you, Andrea, for helping out. And this is one of these things that happens when working online. Yes, indeed. I always log in early just to be sure. Yes, thank you very much, Justice, for that kind introduction. I thank the Second Environmental Court of Santiago and Cristián Delpiano for this kind invitation, and I'm very pleased to be here with my colleagues on this panel. I know that we will be able to resolve the technical issues and learn the crisis that has taken root as of the coronavirus. Started, of course, in March of last year in our region, and as Marcelo has just explained, obviously the scope and its impact on healthcare, we are all very clear that as the months have gone by on the social, environmental, education, and other types of impacts that this pandemic has brought with it. And the challenges go far beyond the individual capacity and capability of states to respond to this unprecedented crisis, as well as the interdependence of potential solutions. The response obviously needs to be international and, as revealed, the interdependence of states in terms of preventing and mitigating the disease, not just for themselves, but for other states as well. In this context, we have seen that the crisis has brought neoliberalism to a breaking point, as it had been on the chopping block prior to the crisis as well. And we've been able to see the impact on the international order as well as a result of the pandemic and this heightened interdependence. So some groups such as the UN Security Council have been virtually absent from the discussion, and it is other institutions that have been brought to the forefront in terms of international cooperation. So when we talk about international governance of public health, obviously it's the WHO where we've all been focusing our attention in recent months with the international health regulations, again, which have been enforced since 2005. And this is the primary set of international regulations for the control of a pandemic. And there have been a lot of concerns about the limitations and the capabilities of the WHO itself. So the question then might be, what contribution to climate change, what contribution rather can public health make to climate change regulations? And I think this is the core issue before us here today. Now, there are some criticisms that the management of public health over the course of last year have been heard, but the question then is, again, what can climate change governance contribute to the healthcare crisis? Before responding, however, to this particular query, let me start by saying that both climate change and the healthcare crisis have a problem of perverse returns. And this is because they are both extraordinarily thorny to resolve. The complexity in the approach to both means that a single solution is not possible. In general, the international community doesn't, rather lacks a single set of regulations because of its naturally fragmented nature. So the response to the pandemic, whether it's COVID-19 or any other crisis, or as Marcelo said a moment ago, over the long term, we see that this dovetails with an understanding of how international cooperation works. Therefore, again, this puts the accent on the WHO that was unthinkable just a few years ago. I think that one of the primary discussions, even in our homes around our dinner tables, has been what is the World Health Organization saying about this? Again, unprecedented level of discussion. And it's also brought to the forefront other sets of international regulations, such as human rights. That is what specifically Soledad will be talking to us about in a moment. So the question is, what role has international law played? What role will it play? What happens with international trade? What happens and what is the impact on the approach to healthcare as a result, again, of this declaration by the WHO of the pandemic? So this set of questions and largely unanswered questions also leads to certain pessimism vis-a-vis the international order. I tend to be a very optimistic person, and that's why I believe that governance of climate change may make some specific contributions from its own experience to the governance of public health. So in that, there are perhaps three core areas. One has to do with the relationship between science and legal regulations. Second, legally protected goods and the international environment. And then a, a appropriate international legal framework that is flexible and responsive. Let me see or address now these three. The relationship between science and international law. I think this is perhaps one of the strengths of international climate law is the creation of the panel before the treaty was created. That panel of experts has also seen that the question, for example, of the 2 degrees, and that the IPCC set that level again before the treaty was even signed. So this type of information, this type of process that has contributed to international environmental law has particularly been the major contributing force to international climate change law. And if we look at the IPCC, we can see that we have scientists proposed by an interdisciplinary committee from all over the world, and they have very interesting backgrounds, very well-known scientists, well reputed by the scientific community, and based on the scientific information, because there is dissemination, again, I think throughout this. I think the member from Chile will be participating subsequently. The panel, of course, has a number of reports. We're expecting for 2022 a new report. So one of the keys to the success of this group, of this panel, is that we see this support for each report as well that is then distributed in each of the states. So this harmonious relationship between hard data on climate change and the legal system that has been forged in that context perhaps is one of the high points and one of the lessons learned that we can share with the healthcare sector, because obviously we need some sort of more reliable management of hard data. And I would expect that this is something that we'll be looking at in the future, again, based on the international health regulations. The second contribution that climate change can make to health governance has to do with legally protected goods that are protected or important to certain countries. Now, this involves the cooperation of all of the interested states and parties. More international law is needed in this regard for topics that are not necessarily clearly international, but they can be perceived as global. Climate change has been described not as an international problem, but as a global problem. So global issues could be to protect the common grounds, that things that are typical or classical, such as law of the sea. And this is the same sort of approach that we might need to take to these international legally protected goods to help to stabilize emissions, greenhouse gas emissions. Again, that same sort of approach from climate change, that's a global objective, could be used in terms of determining the healthcare approach. And we can see that this is, again, a long-term objective and a global one by nature. This is something, again, once we get over the epidemiological process of this pandemic, that is certainly one of our long-term objectives and something as an international community that we need to be looking toward once the crisis per se is over. And as the Chief Justice just noted, it is one of the important things that is economic recovery is another one. So having response to the pandemic and the governance response, public health is important. Recovering public health is important, of course. But second or next will be global economic recovery, which is, of course, beyond the scope of this presentation. Now, when we look at the WHO, we can see that the definition of health is not just the absence of illness and an effort that requires regional, local, national, and international efforts to be achieved in summary. So when we're talking about, again, about international law, we have to take this into consideration. But if we look at domestic law, if good health is one of our rights, and it is under most constitutions, at least it is throughout Latin America, health is a right, therefore, in terms of domestic law. So again, climate change and health share this perspective of being legally protected global goods. And I'm sure we'll hear more about that over the next 2 days. The next thing that I think is of the utmost importance is multilateral cooperation. Cooperation must be timely, flexible, and targeted. But one of the criticisms that we've heard throughout 2020 has to do particularly with multilateralism and attacks on multilateralism. Some writers, such as Benham, say that if we were caught off guard by the pandemic, then we will also be caught off guard by multilateral cooperation, and that has been indeed the case, and it's forced us to rethink multilateral cooperation. The specialists say, Sans Peters says, for example, that the most recent multilateral treaty that looks at international cooperation is the creation of the International Criminal Court, the Rome Agreements. I would say the Paris Accords also, to a certain extent, is a multinational agreement that shows the importance of cooperation. Again, we see climate change in that context contributing to the rewriting of these rules of multilateralism. So I think, again, this is one of the things that where the area of climate change can make a contribution to international global health, to help avoid situations of authoritarianism, for example, which certainly could come to pass within the context of this pandemic, and ensure that the international community focuses on what comes in our next phase that has to do, again, with economic recovery. Therefore, there is a positive framework available and one that provides opportunities for multilateral cooperation. Since the Second World War, this is when the context also of what the UN has been proposing. While negotiations have been perceived as extremely difficult or hard to bring to fruition and so forth, this is true, but at the same time, there has been progress. We have the COP, the Conference of the Parties, and while agreement is not easy, if you are persistent, you can reach agreements, as we have been able to do, for example, the replacement of the Kyoto Protocol and the Kyoto Protocol per se are all examples of how we've been able to negotiate agreements in terms of climate change, which affects the globe. And also, we can also, again, we see the Paris Accords are a clear demonstration of this, of our ability to negotiate over the long term. And this is certainly an example for international or global health. Therefore, I think this also, if we create a regulatory system, rather we have created a regulatory system that has been subject to review, again, in climate change, is a tremendous example, again, looking at the not only the initial agreements, but the reviews by the Conference of the Parties. Again, people talk about the Kyoto Protocol as something that was erroneous, but nonetheless, the important thing is to be able to correct mistakes. We have the Paris agreements that then are a clear demonstration of what can be done in terms of multilateralism. So again, the new thing that we're seeing in these nationally determined contributions allow states to work at their own pace. The contribution of Chile, of course, has been very important. Chile has presented those already, and there's a new standard, and Chile has already achieved its initial goals, and that was one of the commitments that the country had made, and this is a good thing. So multilateral cooperation has shown in the context of climate change that it is possible to create and to be flexible. So to conclude, I just want to note that while the problem of the pandemic are these problems that are certainly complex, as we've been seeing for many years, but there are many points where we can learn from previous experience of multilateralism in climate change. We certainly need to adjust our legal systems, our legal structure for international and global law. That's perfectly self-evident. And while 2020 has been a year that would have been hard pressed to be a worse year, nonetheless, we have reason and good reason for things will improve. Today, our epidemiologists, our experts have become household names this year. And we've seen tremendous strengthening of multilateralism, international cooperation, and international institutions than we had before. So therefore, I believe that this cooperation between science, public health, local law, international law needs to be improved. But again, I believe that there are significant contributions that the international climate change process can contribute to make this international global health process flow more smoothly. hopefully, again, with the greening and hopefully within an appropriate economic context. But the target is to overcome this pandemic and leave lasting institutionality and governance for the future. Again, I would suggest that this be inspired by international climate change regulations. Crises are always an opportunity, as we know, and therefore I would hope that things will be fruitful for all in the future. Thank you very much for your attention.
Queremos pedirle gentilmente a Soledad.
We would like to request Soledad if she can connect right now for her presentation. Hello, good morning. Good morning, everybody. We are all doing great, and please let me introduce you first. Before offering you the floor, Soledad García Muñoz is participating in this forum from Argentina. She is Special Rapporteur on Economic, Social, Cultural, and Environmental Rights of the SRESCER, and she is Vice President of the International Executive Team Amnesty International and President in Gender and Diversity. She has worked as consultant in different agencies of the United Nations and the OAS, the Human Rights of Point University in Chicago, and she has also worked in the prosecutor's office in Republic of Guatemala. Thank you very much, and thank you for your flexibility. No, it is my pleasure. Thank you very much for the invitation to this important event. Congratulations for organizing this. It is tremendously important, and it is putting together two subjects that undoubtedly are in the heart of my mandate. So I am very happy to be sharing with Professors Andrea, Winter, with the Chief Justice Cristián, with you, Alejandro, and with everybody that is here with us today. Certainly, I will follow with the same line that Andrea was talking about and her analysis. I fully agree with it. And it is in this sense that my thoughts about my mandate, and I would like to briefly present, coming from the indivisibility and interdependence of human rights. Everything that is guiding us from the foundation of the mandate 3 years ago. This is the second special rapporteur activity created by the Inter-American Human Rights Organization. First one created more than 20 years ago to be able to promote freedom of speech and the American states. And I have the honor of having been chosen to start working with this and designing the agenda of this activity. It is a mandate that was focused in different activities. And I decided to create a holistic agenda that would place right in the center the interdependence, the interconnection, indivisibility, interrelationship of all human rights. It is in this sense that I believe it is very important to place an emphasis in the relationship that exists between the preservation of the environment and the respect to human rights, specifically from a view that is in the context of the pandemic. So the rapporteur is an independent office of the Inter-American Department. This is the main group of the OAS that has the promotion and protection of human rights throughout the different organizations, as well as the special rapporteur in this area. We work with all of the mechanisms of the activities in protection and case systems and monitoring, and we have been especially working among the different areas of this committee and the COVID-19 group. It has been created to coordinate the responses and due to the situation of the pandemic. In the work that we do from our office, we have been having a very active participation throughout these responses, given that the rights that are in charge of this mandate are in the midst of the uh, situation of the pandemic. In this very sad context, it gives us the possibility to strengthen the message and our mission of helping build an agenda that is comprehensive in terms of human rights in the region, a region that is the one with very tremendous inequality in the region. The poverty and inequality reaches numbers that are really tragic, and even more than in this context. And ICLEC has been studying uh, and it is for millions of people, poverty, extreme poverty, unemployment. And this is why I would like to emphasize these important activities of the committee that try to guide these difficult efforts, as it is a context that has surprised the states, the civil society, the citizens, and for each one of us as well. We have been able to develop some guidelines and important resolutions. 1-2020 in pandemic and human rights for the Americas is this comprehensive and intersectional perspective with recommendations that are provided in terms on how to provide the right to health in the center of the activities of the states, as well as the environmental, cultural, or uh, rights. And for 2020, we are really pushing from the Special Rapporteur Department. This is a very new tool that through a comprehensive intersectional activity considers states that using these international tools will favor the protection of people in COVID-19 from a very wide view, including not only those that are a case, either symptomatic or asymptomatic, but also their family members. And this resolution, and here again, we have this interdependency between health and environment. It's the social determinants that are directly affecting health, such as access and quality of drinking water, the income level of people, quality of life, access to nutritious food, and even the conditions in which people are living. It is a tool that is quite innovative or novel, that a part of systematizing the standards proposes different guidelines that are promoting a focus on human rights in the decision making process of public policies. We are promoting this comprehensive or holistic view of human rights, and I believe it is the pandemic from a more optimistic view, if you wish, that we have to consider the situation. It is trying to have a need in promoting the human rights from this perspective, this indivisibility as well, that has to be considered by the authorities, institutions, and those that are in charge of the governance of our societies, especially throughout this pandemic period of time that is really showing the injustice and inequality of our society. So from here on, the situation of environment and human rights in the American continent is also worrisome for the Commission. Deforestation, the lack of soils, reconversion of the soil for agriculture, the expansion of human population, settlements and infrastructure, intensification of cattle production, among other actions, are all existing in these parts of the continent, as well as fires and others, and they're all linked to labor. And there means also that there is extreme violence where the defenders of the land and other areas are fully exposed to really losing their lives for playing their role. In our region, it is the one that has highest risk in the world when compared to international data for the defenders of nature and environment. So seeing this scenario, we cannot think about repeating all these actions and thinking that we will obtain good results. This pandemic is just showing how human health is strictly linked to the health of ecosystems and how we should put all our effort in protection and restoration of nature as an investment in the long term that undoubtedly the only thing is to consider a recovered world of pandemic. I don't like to talk about post-pandemic because unfortunately we are still very far from this. And more than pandemic, I think we should be using the term that is already being used by different scientists, syndemic, and it is a group of diseases that are all harming the humankind and are precisely having origin in environmental contamination and climate change and the harm that we're doing to nature, basically, for the and Inter-American Commission on Human Rights, this is very important, and it is considering the autonomous activity of rights. It is important to express, but the environmental issue is always present in the area of discussion of the system, specifically in those situations that are all related to the protection of indigenous peoples and their relationship with territories, even though this is still a pending activity to consider the issues of climate change and its effects in human rights from a wider perspective. There are regulatory background that are considering protection of environment and nature. This is why from my mandate that has an A of environment in Spanish, the first organization created with this wording including environmental rights, and that it also considers the desire of the civil society in the Americas to consider the environmental rights as human rights. We are establishing the priority of the environment, as already mentioned, and in the second mandate, we are moving forward in new standards that mean that climate change was presented by the United Nations and the OAS. We are carrying out a project, and we have Professor Winter from Germany with some support of the German cooperation, especially with the Handelsball Association, in developing new standards that provide an idea to the states on how to consider the environment as a human right, and that from the inter-American legal framework with the opportunities of development that are offered. It is in this sense then that in my first mandate last year, we published the first report on the Inter-American standards of human rights. And this first report is quite relevant as it has one section considering the role of the states in climate change, and I would like to present it right here. The right to a healthy environment in our systems is considered in Chapter 11 of San Salvador Protocol, as well as the Inter-American Charter is expressing a healthy environment in its Article 15, the American Declaration of the Rights of the Indigenous People 2016, Article 19, as well as the Social Charter of the American. The resolution also expresses the environment, and the Consultative Opinion 23 of 2017 of the Inter-American Court is very important in this aspect, that expresses or considers a healthy environment very clearly and as an autonomous right in Article 26 in the San Jose, Costa Rica Pact, something very similar and closer. We find it, and the court establishes in this sense the instruments of the environmental governance, which is the application of access to Principle 10 in the Rio Declaration and the Escazú most recently. And this has been very important And we hope that this is very important for the Caribbean and in this area. And in the case of Los Reyes in 2016, and I could be talking much about this, but my timing, Alejandro, probably is almost over, right? And how much of this inter-American activities has been working in the environment, and undoubtedly we are intensifying in this concept of the pandemic. Again, climate change is a full priority for my mandate and for the commission. The commission itself has adopted precautionary measures to be able to protect not directly the environment, but the right to health and as well the environment in the indigenous communities in Peru, San Pedro, or in the case of contaminated or polluted rivers like Mesapa in Honduras or a river in Mexico. So I think in this sense, much has to be done in this area with national institutions that are as important as yours. And in this sense, I would like to take the opportunity again to highlight the importance of the different environmental courts in Chile and to be closing in terms of the context of pandemic, I would like to mention that together with my colleagues in the United Nations, Rapporteur David Boyd, we were calling the states of the Americas to strengthen and not weaken the protection of the environment through the pandemic of COVID-19, understanding that this pandemic is expressing a very frail position of the countries in the Americas, how this is considering the inequality uh, activities and how in the areas that have more contamination and higher deaths as of COVID-19 is where discriminated people live. So this is why I also believe we have a tremendous task ahead of us to use all of the legal, political tools that we have at hand and scientific ones, as Andrea was expressing, and that was also part undoubtedly of all these new standards that the Commission is developing in the framework of the context by placing right in the middle the scientific evidence as a tool and bioethics as important tools to ensure human rights and also to protect the environment in this very hard context, but as well as full of opportunities. So I would like to leave you now without uh, not mentioning the process that you're going through in Chile and the full willingness that we have to provide in the discussion of all these subjects and rights in the context, wishing that the seminar is fully successful for human rights, and I would like to thank you.
Muchas gracias, Soledad. Muy interesante tus palabras, sobre todo esa reflexión respecto al
Thank
mundo.
you very much for those thoughts, particularly your thoughts about the post-pandemic world and how we have to learn to live with it. I understand that you have some time restrictions, so it may be that we will not have you with us for the Q&A, but that is fine. So thank you very much. Let us turn to the presentation by Marcelo Korc. Marcelo has been introduced. We know that he is the head of the Pan American Health Organization's Climate Change and Environmental Determinants, and he will be presenting again on this panel. The floor is yours, Marcelo. Thank you very much, Alejandro. I hope that you can hear me well, and thank you for your remarks to the justice. And once again, following these previous presentations, undoubtedly, I'm not going to address the perspective of law. That is not my strength. I am an expert in public health, so I would like to focus on international law from that perspective. And I've learned a lot already from these other remarks. And I'd like to therefore focus on how, from a public health perspective, we can make use of these legal instruments to carry forth an international and multilateral agenda, as Andrea said a moment ago. And of course, from PAHO, we can continue to contribute to these regulations. On the question of public health, I wanted to talk a little bit about how we at PAHO see health and the environment. To give you just an example, the Americas, as you notice, my colleagues have said, this is a region that is not just one. This is an incredibly diverse region. It is a region with tremendous differences, inequalities, socially, economically, environmentally. It is extremely complex culturally as well, with a vast array of types of cultures and socioeconomic conditions and inequality north to south. And so many of these are associated with inequities, as we call them in healthcare, or things that are patently unfair in terms of healthcare. And we understand that these have to be addressed also, not only domestically, but internationally. Now, what is the status of these known and avoidable risks, environmental risks in the region? We can see that in high income countries, 13% of premature deaths are attributable to these known and avoidable environmental risks. That's 19% in lower and middle income countries, which means to approximately 1 million people a year who are dying prematurely as a result of these known and avoidable environmental risks. And if we look carefully at this, we can see also similar numbers in terms of the pandemic, but we don't have these day-to-day figures as we do, we've seen over the last year in terms of the environment. And we can also see that we're seeing about 1 million premature deaths per year, again, as a result of these avoidable and known environmental risks, again, similar to what we're seeing in the pandemic. And I believe that the pandemic has also shown us clearly quite clearly, the responsibility, the relationships between human elements, plants, animals, and the entire interconnected health system. There is a relationship between environmental health, human health, and animal health, and among others. So how do we then translate the knowledge that we've acquired through the pandemic into concrete actions within the context of law that we can see that is involving or makes it possible to take environmental conflict or environmental public health conflict into the courts on the one hand, but also looking at law in terms of the healthy environment and so forth. Toward that end, we need to see what some of the barriers are to good environmental public health. In our region, there are a lot of barriers that we've seen over the last 20 or 30 years that have to do with governance in public health, particularly environmental public health, because in this area we have policies that are very often ambiguous. There are gaps in several countries where the interpreters are having issues with the audio at origin. We've lost a couple of sentences. The speaker apologizes for his unstable internet. He says that he will try to speak more slowly to hope everything comes through. Returning to the presentation, we can see, therefore, that these barriers to good governance involve policies of public health and public health in the environmental perspective that do not consider public health, and vice versa. Very often we see that the vision is just one for protecting the environment without connecting that to public health as well. We know also that there is a lack of coordination with other relevant sectors. Obviously, environmental health has to be associated with public health and coordinated with other sectors. Particularly, we should see that environmental protections should come within the context of universal health, or what is known as universal access to health within the context of access to primary health care. These environmental healthcare systems, and certainly Chile is an example of this, of what can happen in terms of a shortage of prepared, trained professionals, resources, financial and others. Let me give you an example of something that happened yesterday in the context of framework law on climate change in Chile. A colleague from the Ministry of Health said that while within the context of climate change includes all sectors, it is not clear where the financing from other sectors would come from within the framework of this framework law on climate change. And it's not clear whether they can act, for example, in public health through this regulation to reduce the impact of things stemming from the environment, the impact of things stemming from the environment. And lastly, also, we see that there is a misunderstanding in certain policies. For example, the impact of a transportation policy, how that could impact public health, and what the interactions are there. And there are interactions, but it's not unique. Just for example, in transportation, while you include air quality, or in public transport, this may be included, you don't very often look at where the public transportation service will be located. When they're planning for that, they don't take into consideration the location of public health services, both in urban, but particularly in rural areas. So what is therefore the opportunity that we have before us? I would say that it is the 2020 Sustainable Development Objectives and goals. The multilateralism that we have is this 2030 agenda. The SDGs are, again, 17 SDGs that are intimately related to other goals that from the healthcare sector are what we called healthcare determinants, and in this case, environmental determinants of health. That's clean water, sanitation, wastewater control, actions on behalf of the climate, and responsible consumption, among others. Now, how does all of this interact? As I mentioned a moment ago, and Andrea and Soledad also addressed the topic of the legal framework, the WHO in its bylaws defines healthcare as enjoying the maximum level of health that is attainable as one of the fundamental rights to health. And within the framework of PAHO and within the WHO, there are a series of values that include social inclusion, equity in health, legitimacy, freedom, and solidarity among countries. And that's all well and good, but how do we translate this into action? And we see this, there's a very delicate balance between protection mechanisms, the framework of economic, social, and other rights, but also in terms of empowerment, that is, that of responsibility, individual empowerment and protection, social, collective, and looking into the future, the responsibility that we have at the end of the day, that is what is going to lead us toward sustainability. What responsibilities do we have today looking toward the future? And that can be whether, of course, it's from the healthcare perspective, focusing on each of their specific contexts, because we cannot engage just in general statements. We've worked very hard on our generalities, but we also need to learn to work specifically, to be well structured, so that in the understanding that not all children are vulnerable in the same way, not all women are vulnerable in the same way. It's not just children that are living in situations of vulnerabilities, it's children that may have certain disabilities, who live in certain locations, in specific spaces. What is the context for that? How can we address this from a multi-sectoral, comprehensive approach at the primary, secondary, or tertiary levels? And therefore, within the context of the 2030 SDGs, when we look at the strategy, we can see the worldwide health strategy approved by the WHO with a strategic plan approved again by the member states for the period 2021 to 2025 that has certain specific initiatives for determinants. In 2020, we established this worldwide strategy on health, environment, and climate change. And that means that as the regional subsidiary at PAHO, we also have our own document for the decade within the region. This has elements that, of course, come from a committee on inequalities and health in the Americas, as well as the report from the Committee on Universal Health that give us the necessary inputs and the principles and values of the right to health, and particularly equality and equity in health, to be able to carry forth and move forward this agenda. We also, of course, have our multilateral agenda, as Andrea mentioned a moment ago, to carry out this initiative in the context of the Paris Accords, the UN Framework Agreement on Climate Change, and so on and so forth. And so we do have these legal tools to move forward regionally on this regional agenda within the Americas. Within the framework of this world strategy, you can see on screen what our strategic objectives are. We have our goal, which is to reduce both illness and inequality in healthcare attributable to environmental risks in the region, And our goal is to strengthen the capacity of healthcare actors in all sectors to approach in their approach to environmental determinants, placing an accent on people who live in vulnerable conditions. So again, we're looking at people who are living within the healthcare system rather, and outside of it, and tying these things together and focusing on the specific context to understand what the conditions of vulnerability are that are being experienced so that we can take the specific and necessary steps. That is why we are working on 4 specific areas at the macro level that are really seeking to improve these environmental and public health programs by strengthening leadership of governance through appropriate public health policies based on international agreements and accords that have been approved and ratified by member states, and the strengthening of the workforce in the area of public health, improvements in terms of all of this to improve the essential services of environmental public health that should exist also in providing policy, surveillance, communication of risk, and so forth, and 2 essential strategic points that have to do with actions, both within healthcare, that is, to provide for resilient, environmentally sustainable approaches so that, for example, healthcare establishments will have appropriate waste management and clean water so that they can be resilient to climate, so that they have appropriate infrastructure as well, so that they can also have the ability to be resilient to climate, to environmental alerts, for example, of heat waves or the water quality, water or the air pollution. And at the same time, we from the healthcare systems know that we have the responsibility to mitigate climate change and understand what the carbon footprint is that our healthcare systems are making. Very often, we don't think about the significant contributions that the healthcare system can make to carbon footprint reduction. If we look at the National Health Service of Great Britain, for example, that is our gold standard, as we say, in terms of environmentally sustainable and resilient healthcare systems. Some 8 to 10% of carbon emissions are associated with healthcare systems worldwide. We're talking about not just hospitals, but also transportation, pharmaceutical industries, as well as food industries that are linked to healthcare. So how do we take all of this into our cities, into our communities in a healthy, resilient fashion, working hand in hand with other healthcare programs and sectors to promote those environmental health policies that need to be and approaches that should be included within the context of sustainable development. At PAHO, we believe that this is our call to action. It is a shared responsibility. There's a call to action for international law to provide appropriate tools, moral ethics that will enable us to have this call to action to bring international law together with healthcare so we can reduce inequalities, so that we can bring it together with environmental justice, so that we can understand the linkages and create alliances for knowledge and action as well as for stakeholder participation from the national authorities, regional authorities, local authorities across all sectors, as well as the community, both at the private and public sector level, working hand in hand with the international organizations that continuously seek to provide guidance and orientation to countries, as well as technical cooperation as needed to provide tools and policy mechanisms to allow for these results so that by 2030 we can see full dovetailing and the attainment of all of the SDGs. Thank you all very much for your attention.
Thank you, Marcelo. You have presented us with many challenges, specifically how to make environmental protection more efficient, as well as health protection, by avoiding duplicity and in situations such as this one. We will now go to a Q&A round, and it will be presented to Andrea as well as Marcelo. Professor Winter has not been able to connect, and his presentation will be given later on. We have a question for Andrea. Which is the governance model that should be implemented when considering risk, and whether this should be global, local, or multi-level? Thank you very much, Justice, and to who asked this question. I always think that, specifically thinking about climate change, the need of a multi-level approach is what is needed. As I was expressing in the second pillar of the contribution of the climate change activities, this is considering a common good, which is climate change. But this approach also requires or is included in the climate change phenomena, and this should be multi-level. And this is how it becomes an evil issue. It is very hard to consider with a just one level view. It could not be considered from an exclusive perspective of the international community and could not be done by the national state either. Therefore, a trend that we can see in certain problems that arise in our societies, and this is related to the risk of living in a society. And of course, the pandemic has confronted us to this risk, which is a virus that is not possible to control, nor from a country or a region or a continent, but rather we require a community and an approach from different perspectives. And it is important to strengthen that it is from specific activities. And that is one of the problems that a pandemic is presenting, which is the level of accepted risk as a society. And undoubtedly, what we are willing to live with in a society in Latin American countries is not exactly the same as the risk level that those citizens that live, for example, in developed countries. And it is one of the challenges at multi-level that exist, and how to reconcile these different approaches from the perspective of international societies in terms of risk, and how the national and international societies are willing to go through. And of course, we go back to the multilateral challenges. Marcelo was explaining very well. These are challenges as you are expressing, and it has to be done at multi-level, which is what I can respond right now. Thank you, Andrea. I have a question for Marcelo. Yes, I am here. I just turned off the video because of my internet connection. I am here. The connection problems were only at the beginning of your presentation. The final part was perfect. Thank you. Okay, the question that we received is how has the COVID emergency affected the satisfaction of guarantees of quality, quantity, accessibility to the rights of water, to water? The right to water. Yes, that is what you said. Yes. It is a wonderful question. This is something that we saw it with the Rapporteur of the United Nations to the rights to water. Everything related to water and sanitation has had quite a sensitivity in the past years, as we have probably not seen in other times. But as Andrea also mentioned, in terms at multi-level, we are seeing these multi-level sensitivities, and it depends on the sector that we're working with. I can even say it's a mea culpa that in the health sector, the health centers do not have the same importance or do not measure it as the same in the same importance level as a sanitation agent have to exert on their activities. Probably one of the main problems that we have seen this year in the dialogue with different sectors has been the different languages that exist between the community, the health sector, and the water and sanitation sector. Maybe at macro level, the language is the same. If we go to detail, there is no clear understanding on how to understand water and sanitation. And this is happening in health centers that we are requesting them in some cases for the Caribbean countries, for example, that when going through their sanitation, they have to at the same time go through conservation of water because they do not have enough water. If, for example, you see the guidelines that you have received or maybe the posters that you have, and this is an example, wash your hands for 50 seconds with water and soap, right? Great. We see it everywhere, but what do we do in those countries that do not have water? We have to give them the same message. And this is why it is so important to be focused in the specific context. And this is why multi-level in specific context is important, not only at national level. But look, Chile, for example, Chile that has always rainfall in the south, it is not the same for the north of the country. And this is where we consider context of right, the legal context, the political context, and the messages that we provide to the population. They are all have to be related to the context that we're going through. So it is very complex. But if we are learning something, it is exactly this: how we have to learn how to be specific, how we have to be working at multi-level and working from the local to the international level. But what is our duty? Not to try to just be internationalist at local level and local in the international level. Each situation has its own space and we have to respect it. Thank you, Marcelo. Very true. This pandemic is really stressing us all in different activities. Andrea, I have another question for you. Which would be the role of the national judges in the governance process that are implemented when considering the risk of COVID? It is a challenging question. I will just express an opinion here. I believe that COVID as a pandemic involves every power in the state. We first tend to think that it is in the hands of the executive power, but those first measures, it is done by the Congress participating, but as all these problems are at multi-level and this level of complexity are considering the national judges. This is where it is necessary to have the judiciary, of course, working with justice. And in many analyses, we have seen how the national states have confronted COVID and which have been the responses. And the responses should only be at administrative level and sanitary measures subject to these sanitary measures, and how other countries or some states, even Chile, have considered that they needed to consider the legal code, for example, to be able to consider certain actions that were thought to be necessary to control with regard to the pandemic. Evidently, then, these national responses should go together with a judiciary that at the same time is willing to interpret these standards that were presented by the beginning of April or even May, like in the case of Chile, and as reasonable as possible. So again, we go back to the first question. The risk level that the pandemic has presented is very high, and the response of the society, of each state has been different. But if this goes together with a legal power that is willing to harmonize and apply and see the specific cases in which the application of these measures have been, that even can be can have a criminal character, we will be transferring this in the longer term. This is my first idea, thinking about this criticism that some measures have been taken in considering the pandemic and that were considered in the modifications to the criminal code. This provides a face to the repressive power of the state. So to be willing to see for each specific case, they are the ones that have to define the fundamental rights that are here at stake, which is Soledad. Probably, if she is here, can provide a better response, but it is what I believe should be happening in this case. Thank you, Andrea. Thank you very much. And yes, judges do have an important role in this area. Marcelo, I have one last question for you. How to satisfy the right to health in a context of a pandemic, considering the situation of indigenous people in Latin America, and whether you know of any experiences that you can use as an example. Wow, that is a very small question. Well, you have 20 more minutes then. Wait, let me go get my children because that's why internet's not working. I think that right now and in this very minute, what we have seen from our organization, and it has meant a tremendous line of thought of what a right to health means, and working together with the advisor in health, and that the work in the Congress, we've been able to see that the right to health, how to translate this in specific activities and to populations and their understanding. The only thing that I can say here is that we all agree that we have to establish a democratic leadership in terms of a right to health. And this democratic activity is not only voting, and this means an action, an activity and leadership. And as an example, I have a case that we have seen more in the US, just to provide a specific example of what you mentioned. Indigenous people in the US that have a characteristic within the federal framework and do not have to be fully guided by the federal laws, but rather they also use their internal laws and the reservations. They have been acting according to their culture, and it has been seen that some of them, because here's where we have the state framework and the other frameworks, which is the legislation within the indigenous territories. We have seen that in the specific case, there were two indigenous people, one in the state of Oklahoma, very close to Tulsa, where they have been acting in the pandemic as no other state in the US. So they're indigenous leaders that have considered the right to health in a completely different framework of what we hear in the average of the US, that where there is no universal health law and access to health is provided mainly through the private sector, and the public system is for the extremely poor or for it's either Medicaid or Medicare for those that are retired as well. In the reservations or the indigenous territories that do have their own health system, as in the US, the health system is more of a local system. It's the Cherokee population has had the lowest cases of COVID and the lowest number of deaths of all of the populations. Specifically, if we see it with the population that exists in the US, as their public health measures have been done with their own leaders, with their own communities. And I think that example is really describing how we should see this. I would like to go back to the first question. There should be a clear leadership at national level, a clear leadership at international level, clear leadership through the regional authorities, and also clear leadership at local level, either indigenous or rural or urban, and that this has to be a democratic leadership to allow solutions to be according to those people and those cultures. Thank you very much, Marcelo. Undoubtedly, this situation is putting to test all of the leadership at national or international level or even local level. I would like to especially thank you and Andrea for your participations, for your kind responses to the different questions. And now we have a Professor Venter connected now, and we'll see if now it works. But again, we are setting you free so that we can go to the last part of the panel. Thank you very much.
Gusto de conocerte. Igualmente, mucho gusto, lo escuchamos. Muy amable, muchas
Very much. It's been a pleasure. Thank you. Thank you very much to the Justice. We thank all of our speakers for this first panel on our fourth International Forum on Environmental Justice. We're going to take a break and come back with our second panel on climate change. We will come back at noon at 12 o'clock. It is 11:30 now in Chile, so we'll take a 30-minute break. And we will come back at noon Chile time for our next panel at this 4th International Forum on Environmental Justice. Thank you.